Tell me about your symptoms before the surgery.
The symptoms before the surgery, it would be, my back would tighten up pretty bad. I'd have to ice every night, and I'd have to put heat on it in the morning. I was a runner back then, and what happened was when I was running, my back would start cramping up, and my leg would go completely numb. Where I couldn't.
Only when you were running, or as
When I was
well?
walking too,
Okay.
between the walking and running, and it started when I was only running, and then I had to quit running because there was so much pain in my back. Started walking, then when I started walking, it'd go completely numb, and I couldn't feel my leg. Then I'd have to lean over for about 30 seconds to a minute. And it felt like I got blood in there. Then I could feel it again. And
So we have a name for that. We call it claudication, what you just described.
yep, okay.
That means that there's pressure on the spine, in the lower lumbar spine, that practically prevent you of getting a full function of your nerves.
Yeah. Well, when I had it, I couldn't feel my leg. So I mean, it was more of a danger thing, because when you're running and your leg just goes out, you just lose balance.
But as well, some pain, right?
Oh, there was pain there, yeah, absolutely.
Yeah.
There was pain there
How
too.
bad was the pain?
I'd say on a scale from 1 to 10, when it was at the worst, it's probably about a 7 or 8.
7 or 8. No,
Somewhere in that area.
no, surgery wasn't. You look like somebody who had the surgery a year ago,
Okay.
but you didn't have the surgery a year ago. When was the surgery?
4 weeks ago tomorrow.
4 weeks ago tomorrow.
Yep.
How long did you stay in the hospital?
I wasn't in the hospital. I went to I had the procedure. I was in there for, I think, 2 hours.
2 hours. So 2 hours after surgery, you went home.
Yep. I think they told me that the surgery took 23 minutes.
We did a 1-level OLIF for L4-5, and you had stenosis, spondylolisthesis, but as well you have a bad disc up here. Do you remember why we decided not to fix that disc?
I do not remember. I know that you said there was a possibility that was a problem, but you thought at that time it wasn't a problem. So let's
Yeah.
just leave it
Yeah.
and not do anything at this time. So
But right now you have no symptoms, correct?
no symptoms. The only symptoms I have right now is
Yeah.
a little bit of tightness, and it's more of a discomfort
Surgical pain.
where you went in with the
Yeah,
with
yeah.
the
No,
procedure.
just the fact that your symptoms are gone, meaning that was the right decision,
Yeah.
not to fix the other one. And the reason we decided to fix only the bottom one and not the top one, because all your symptoms actually were corresponding. They were aligned with the problem of the bottom disc. You didn't have much symptoms that correspond to the upper disc.
Okay.
And so we decided to fix you, not the pictures. Sometimes if you decide to fix the picture, we do sometimes more than necessary, and that is a risk that usually, at least in our protocol, is not necessary.
Okay.
Now, obviously, surgery didn't make you younger,
Yeah. I wish
but
it could.
But it did take the symptoms away.
Right. Yeah. Right now, yes.
Yes,
Absolutely.
yes. How much do you walk now?
I walk I've been walking 3 miles twice a day.
3 miles so 6 miles a day.
6 miles a day. Yeah.
So that is very good for somebody who just had this surgery a month ago. How many weeks after the surgery did you start walking 3 miles?
Well, it took me 2 weeks. 2 weeks I started to go 2 miles, and the third week I started to go 3 miles twice a day.
Okay,
so.
well, you see that is would have been unimaginable with open old-fashioned surgery, because those muscles were in your spine destroyed with open old-fashioned
Right.
traditional surgery.
Right.
Now, so I'm actually very happy with what I hear. You're actually ahead of the curve with the healing process.
Okay.
What you're describing is good.
Okay.
So I'm very happy with the results so far.
But if you're happy, I'm happy.
Yes.
Okay.
Any other question for me?
No, this is great. So far, it's been great. So.
Excellent. Thank you so much.
Yep.
I appreciate